Hello everybody, thank you very much for listening to my talk this afternoon. I'm delighted to be joining you for St Luke's Symposium 2020. My name is Conor Woods. I'm an endocrinologist and general physician in Naas Hospital and in Tala, and I've been asked to just briefly mention some of the challenges that our foreign graduates face coming to Ireland. The IMGTI scheme is offered to non-EU foreign graduates to come for a defined period of time for training and experience in Ireland. And the goal is that these graduates would then go back to their countries of origin, so that we're not draining those countries of their best and brightest and highly educated doctors. There are a number of countries involved in this scheme, but my experience has predominantly been with graduates from Pakistan, the CPSP programme. And in the last year or two, Sudan have come on board and are sending graduates over. I'm conscious there might be one or two other countries involved in it. So what we offer is 2 years clinical experience in Ireland, in level 3 hospitals. The first year is an SHO, and then the second year is a medical registrar. Just to touch on the word assimilation, I was looking up some definitions of it, and you can argue about the definition of it, but I think one of the issues, and indeed it's very topical this week in the media, is whether it's full assimilation and full recognition and full integration, or whether it's partial. And certainly the programme that I'm involved in is kind of a partial assimilation, that we offer 2 years training with a view that those graduates have to go back, and that's the agreement before the graduates come. I know that's an issue for many foreign doctors working in Ireland, and I don't have the answer for that at the moment, unfortunately. So for the trainees that come on this programme, they are already established on their 4-year fellowship programme in their country, be it Pakistan or Sudan. It's not quite the same as HST here, and it's not quite the same as BST. It's a 4-year fellowship. If they wish to come to Ireland, they can apply, and if they're shortlisted, we would offer them a Skype or video conference. And if they meet the criteria and accept a place, we would offer them, and they come to Ireland and apply for their visas and medical council registration. Before COVID, we would have done an induction day in the college, and we would have encouraged them to attend for local induction and local upskilling with their teams and shadowing if possible. Obviously, this year is different. There's 2 weeks quarantine that the graduates have to undergo, and a lot of it was done virtually. I would just make a point that the first few weeks and months can be tough for these graduates coming into Ireland, finding their feet. It can take some graduates a long time to get settled. Once they do, by and large, they really flourish. And indeed, by the time they make it up to medical registrar level in the second year, I find them performing at a very high level and extremely competent. So again, if I was to categorise the CPSP and SMSP graduates, I find their knowledge is excellent. Their skills and procedures is excellent. They have expertise and knowledge above and what I would have for certain diseases. They have a great work ethic. They really want to self-improve. They want to learn. And they're very prestigious at getting their exams. Just to briefly mention some of the assessments that we do. We obviously do an annual assessment. We would respond to any queries, be it from trainees themselves or trainers. But we do keep an eye out for medical council 3-month supervision reports. This is one of my colleagues in Naas signing off on an excellent graduate. Just to point out, they categorise the domains of good professional practice, which we're all well aware of. 1 is awful and 5 is amazing. And really we're expecting 3 upwards. It wouldn't be unusual in the first assessment, or maybe even the first 2 assessments, that there might be the odd 2 or a couple of 2s. And that wouldn't necessarily alarm me, but would definitely make us take note to keep an eye on this trainee. And what we're expecting is a shift to the right, that the 2s over the year shift up to 3s and 4s. And if we see that, we're very reassured. So obviously I was thinking about this talk, and I thought I'd give an example of Seamus. I've obviously changed his name to protect his identity. Seamus is from the foothills of the Himalayas. And the reason I mentioned Seamus is actually he worked for me, and he came to me after 2 years after his assessment at college, and he wanted to get across to me how much he benefited from Ireland, and he said he learned a lot, but how difficult he found it when he got here first. And you might compare your own training abroad if you've been abroad. I was lucky to go to England, and I didn't have as tricky a journey as Seamus did to do my training. But he has to get rid of 4 or 5 flights to Dublin. It's 4 or 5 hour time zone difference. English is not his first language. He had to go through the arduous process of getting visas, and that's gotten harder this year with COVID. He had to rent a house, and depending where you are in Ireland, Naas is actually very tricky to get accommodation because it's on the commuter belt. He had to register with the medical council and he had to show up to the Garda station, as a lot of foreign citizens do, to show ID at relatively short notice. But he just made this point at the end of his 2 years that nobody else had really made to me, that everything was just so different. And he kept on saying that phrase, everything is just so different. Obviously, there's the obvious computer and data access software programs we have to use. This is a list of 12 programs that I can list off the top of my head, with 12 different passwords. Once or twice a year I get locked out of these and have to reset. That's perhaps, you can overcome these things. It's a bit tricky, but you do get used to it. And something Seamus and indeed all our graduates would tell us after 2 years is that they really feel they learn a lot about the approach we take to chronic diseases. So bear in mind, they don't have a lot of chronic diseases yet in Pakistan and Sudan, but they really are taken aback at the approach we bring, be it the guideline adherence and the MDT approach. And as you and I both know, sometimes the social worker is the most important person in a patient's care pathway. And we bring in OT, we bring in physio, and they really benefit from this approach. It opens their eyes, I think, to guidelines and what the next step is and what's appropriate. Bearing in mind, sometimes there can be difficulties for our foreign graduates. And I mentioned OT. Seamus specifically gave me an example of how puzzled he was. This was early on in, I think, month 1. I had asked for OT for an 84-year-old lady recovering from pneumonia, and he didn't understand why I wanted surgery on this lady. So OT to him was an operating theatre. To him, Seamus thought VHI was HIV. So each country and indeed each hospital would have localisms. Bear in mind that whether you work in Letterkenny and Wexford, and I've worked in both and enjoyed my time, each hospital will have a slightly different culture. Indeed, Nace, if I use it as an example, we have a huge horse industry around us. So I've met jockeys and blacksmiths. I've never met a blacksmith before in my life, but I meet them here in Nace Hospital. And so each hospital will have its own local culture that we all have to get used to, and that can be tricky for foreign graduates. I'm conscious that there are perhaps bigger cultural differences, not just the weather, but Ireland is predominantly white population. We speak the finest English on the planet. We used to be a Catholic society, and I'm not sure what we are now. We have made excellent strides in many aspects of our society over recent years, but we're by no means finished in that journey. And equality for many in our society is a long way away. We have issues with alcohol and drugs and other things. But I'm conscious that if you come from Sudan or Pakistan or elsewhere in the world, these are issues that might be quite jarring. They might be quite liberating, actually, to be able to openly discuss some of these issues. So I'm just conscious that might impact on our foreign graduates. And it's hard to qualify or quantify that. Conscious that be it the college or the HSE may have its own cultural issues. And this is a very difficult year for the HSE, and I'm not having a swipe at them, but some of the communication and the emails and the documents and the PDF documents and FYI, please share with everybody, and just conscious that the culture sometimes can leave me a bit cold, and I wonder about those who don't necessarily understand English that well or as well as I do, how they feel about it. Conscious that a lot of our graduates deal with the Department of Foreign Affairs, the Department of HSE and Health, and have many obstacles to get through just to work. Even the college has its own culture. I haven't put it up here. How do we communicate with our trainees? I actually think we do a good job, but it's always just to be aware of that. So I'm getting to the end of my talk, and I just wanted to hammer home to the trainers out there. We are lucky to train these guys, and I certainly feel privileged to meet them, and I learn from them and I ask them questions. Bear in mind that the first few months can be really tough. And it may not be a professional or medical issue that's holding them back. It may be because they're having difficulty with their visas for their family. Talk to your HRs, get their on-call duty, reduced for the first few weeks. I'm in a privileged position that I can see over the 2 years. I see them improve, and I see the reports coming through. I can see that they really flourish and they really do well. And when they come after the 2 years, they're genuinely thankful and grateful for their opportunity in Ireland. So the trainees themselves, there are issues with level 3 and level 4 hospitals. There are issues with full assimilation or full recognition of the time in Ireland. But some of this is not of the college's fixing. We don't control EU law. We can't control the Medical Practitioners Act. And so what I would say to trainees is Please enjoy your time in Ireland. Thank you very much for coming. And make sure when you're leaving Ireland that every opportunity that is available to you, and I appreciate perhaps not all the opportunities are available to you, but what is available, that you make sure you take full advantage of it. Demand study days, demand training, demand teaching. Look on the college's website for courses, sign yourself up, improve your CV, get your medical exam, so that when you leave Ireland you can look back and say, I've learned a whole new approach to medicine, and I've upgraded my CV with exams and courses and so forth. So look, I'll stop there. Thank you very much for your attention, and I hope you have a fantastic weekend. Thank you. Bye bye.